Hey, it's Dr. Allin here, Evolve Chiropractic in Woodstock. I want to walk you through how I structure care in the office. So we're about to start care, and I just want to give you realistic expectations for how long this is going to take and what types of treatments you're going to be looking at. So typically speaking, if you're walking into my office, most of the time we're experiencing some type of pain. So the style of care that we're going to start with is basically called relief care. So this type of care typically is going to take 2 to 4 weeks of time, and we're looking at approximately 3 times per week, almost up to daily. Now that depends on the severity of pain that you're in. I say daily because if you're basically crawling into my office, we're going to make sure that we hit this situation as hard as we possibly can to make changes in the body as quickly as possible. So as far as the time frame, 2 to 4 weeks, 3 times a week to daily, our goal here is to reduce your pain by 50 to 75% within that time frame. Our range of motion, I'd like to basically restore full range of motion of the spine to a normal range that's mostly pain-free. Now the types of different therapies that we can use here, if you are crawling into my office, we do have modalities like electric stim, cold laser, ultrasound, things that are used to reduce muscle spasm, reduce inflammation, basically pain relief modalities. Ice and heat are also used in those situations where you're unable to come into the office and do any of the therapeutic exercises that you have prescribed to you. We will be using different types of traction. Mainly what we're trying to do at the beginning stages is create space and relieve pressure out of the system. So we'll be doing a lot of different types of decompression traction depending on where the areas of your spine are compressed. Trigger point therapy is the type of massage therapy that we'll use, and this is basically where we're trying to find areas in the muscle that are pain generators. So we want to find those areas and treat them so that they are no longer referring pain to distant sites. The chiropractic adjustment, we're going to use these adjustments to restore mobility to movement to areas of the spine that aren't moving properly, or even joints in the body that aren't moving properly. The goal is to just restore that movement and make sure that we can start to increase that range of motion back to a pain-free state. So we're basically just telling the body that it's safe to go into a direction that it's not used to going into. The therapeutic exercises used during this style of care are going to be basically primarily focused around range of motion. So we want to make sure that we can move through the entire range of motion of the spine fully before we start adding any kind of strengthening or stabilization type exercises. Now typically speaking, this is a pretty standard chiropractic practice. So people will go through relief care. As soon as they achieve that reduction in pain, they'll discontinue care. And typically what happens at that point, 6 to 9 months later, they come back into my office with the same exact problem, if not a little bit worse than the last time I saw them, and it takes a little bit longer this time now to achieve that pain reduction goal. So what sets my office apart from most chiropractic offices is the fact that we utilize corrective care. Now, corrective care is an evidence-based style of chiropractic where we look at your spine, we look at the positioning of the spine, and we try to restore balance within gravity to reduce pressure on nerves, discs, and basically make sure that your posture is as efficient as possible so that the brain connection to the rest of your body and vice versa is working at 100%. Now, this style of care is not for everybody due to the fact of the time constraint. If you're looking at corrective care, think of it like braces on your teeth. It takes a lot of time to apply stress to ligaments to get them to actually change their position and actually hold that position. So you're looking at, depending on how severe your postural distortions are, anywhere from 3 to 12 months of care at 3 times per week. It sounds like a lot, but in reality, when we utilize this style of care, on the research that was done on this type of care, 2 years follow-up, patients have maintained the changes in pain and disability scores where they found improvements with relief care moving into corrective care at 2 years follow-up. So our goal with corrective care is long-term change. And what we're really looking at doing is restoring posture to an efficient position. We're trying to get your function and your movement restored. So not just range of motion, but now we're looking at stabilizing. We're looking at functional types of movements like reaching, squatting, and we're also looking at overall health measures like sleep. different types of things like that. So we're looking at overall health, not just how your body holds yourself in space. Now, the main difference between relief and corrective is obviously the time, the duration of care, but we're also looking at the type of traction that we use. So typically in relief care, we're trying to decompress the system, create space. Now, when we go into corrective care, now we're going to start to add in either some extension types of traction or translation types of traction, all depending on what we found on the x-ray. So our goal is to return the body back to that balanced state within gravity and use different types of traction to do that. There's probably 15 to 20 different types of tractions that we can utilize in the office depending on what your specific case needs. Now, we also do chiropractic adjustments because we're still training the body that it's safe to go into these new end ranges of motion. The types of massage therapy we would use during this style of care, I call it structural myofascial work. So this is like that deep tissue type work. We're really starting to open up the muscles and the fascia that have been kind of stuck in old patterns. So we get the spine moving in all these directions, but we also want to bring the muscles and everything else along for the ride to make sure that the entire body as a unit is being held in this new position. And then as far as the therapeutic exercise is concerned, we're moving away from the idea of just specific range of motion, because now that's been restored, we're going to start to stabilize the system. So we're going to work on core strength, we're going to work on isometric, so if your body's stuck in a certain position, we're going to start to train the muscles on the opposite side of the body to hold that position. So the whole idea, again, is that we're restoring the posture, we're restoring function and movement and overall health measures for long-term change. So once we get through our corrective care, we've done the hard work, we've put in the time, now we want to maintain, and that's what we call wellness or maintenance care. Now, depending on the stressors in your life, everyone's going to be a little bit different as far as frequency on this one. Sometimes patients feel good coming in once a month. Sometimes it's every 3 weeks, every 2 weeks, once a week. It really all depends on how much stress you put on your body. So somebody who sits at a desk all day might need more than somebody who's more mobile and active. It really just depends on the stressors that you have and what your body feels like it needs. Basically, this is the easy stuff. This is when we're not experiencing any pain. We're just basically coming in, getting our adjustments, and making sure that everything's moving appropriately so we don't start to creep back into what got us here in the first place. Now, the style of care that we use here, massage therapy, can be a blend of relaxation or Swedish techniques, deep tissue therapies, trigger point, just basically working on things that have built up from stressors in our lives. And then chiropractic adjustments, we're just evaluating the spine, making sure that all the segments are moving independently and that the spine is moving as a unit as a whole. And then as far as the therapeutic exercises, by the time patients get here, through the office, we're going to give you tools to basically maintain the changes at home. So you should have approximately a 30-minute workout routine that you're doing daily. We're going to have addressed nutrition, hydration, sleep, all these things that these habits that you're going to have changed throughout this entire process of going through corrective type care. So a lot of the times patients come in and they want to start here. So that's not possible, or if you do start here, what's going to happen is you're going to basically be maintaining a pain state that you're in. Patients will come in, they start in relief care, and then they'll kind of start creeping to once a week, and once you get to that once a week or once every other week time frame or that frequency, that's where you're going to basically just maintain that pain state that you're in. So patients come in and be like, yeah, it still hurts, let's adjust it, it feels better for a few days, and then we do it again. So we're not really achieving that corrective type of care that gives you long-term relief and changes in pain, disability, all those types of indexes. So this is pretty much how I structure care in the office. If you have any questions about that, feel free to ask our staff, give us a call, shoot me an email. We'd be glad to help you out with any questions you have. But just remember, the main thing, the most important concept, the important factor in your care is the frequency of care that you come in. I hope this was helpful. Again, any questions, feel free to reach out. We look forward to helping you, and congratulations on your new step in your health journey.